satisfying for me. It's been a quick process, and like we said earlier, I think I took too much time, wasting my time somewhere. It's been very fast for me. It's taken, I think, within 3-4 months. This gap was like big, and now it's closed technically. So I think I'm more than satisfied. I'm so happy. It's like it was quick for me, and I'm like, ooh.
Shoulder to lean on when the tears couldn't hide. You're the one who lifts me up when I'm feeling down. With you, my friend, there's no need to wear a frown. Friendship, oh friendship, upon the storms and sunny days together.
Will examine your teeth, bite, and jaw position. Treatment options will be explained to you, and a recommendation will be made. Diagnostic records are required for the doctor to accurately assess your teeth and bite. These include photographs of your face and teeth, as well as x-rays of your mouth and head. Your orthodontist will also take impressions of your teeth, which will be used to make a clay-like model of your mouth. These and possibly additional records will help the doctor diagnose your condition and create your personalized treatment plan. Your orthodontist will use braces and possibly other types of orthodontic appliances to gently guide your teeth and jaws into correct positions. Additional appliances may be prescribed, such as elastics, to help improve the alignment of your teeth and bite. Your cooperation, especially in the area of home care and oral hygiene, will be necessary to achieve a successful treatment outcome.
While placing your brackets, it's important that your teeth remain dry during the bonding appointment. We will place cheek retractors to gently pull your cheeks away from your teeth. Cotton rolls or a tongue suction will be used to help us control your saliva and absorb excess water. We will use pumice in a rubber cup to polish your teeth before we get started. Each tooth that will have a bracket will be polished with this method. An etching solution will then be placed on your teeth and will sit for 20 to 30 seconds before being rinsed off using water and suction. This may have a sour taste. We will then dry and paint a primer on your teeth, which will not be rinsed off. Adhesive will be placed on the bracket pad and the bracket will then be placed on the tooth. The assistant will clean up any extra adhesive from around the brackets, and the doctor will come in to properly position the brackets on your teeth. We will then cure each bracket until all your teeth are bonded.
So flat out fantastic at what you do that your talent cannot be dismissed.
Any more stuff? Also, that's the wrong instrument.
Now let's spend a few minutes to talk about how to take care of them. First, brushing. People tend to brush the same spots and miss the same spots. So it's important to develop a habit with your brushing. First, you want to make sure that you angle the toothbrush on the gum and the tooth. And to do that, make one pass all the way around your mouth. Next, you want to brush below the bracket and above the brackets, making sure to remove all of the plaque.
The proxy brush is a nylon bristled brush intended to clean in between the teeth. Place it under the arch wire in between two teeth, then move it up and down, cleaning the edge of the bracket toward the back, in between the two teeth, then the edge of the bracket toward the front. Pass the floss and threader up between two teeth. Slide the floss back and forth several times, cleaning the surfaces of these teeth. Be sure to clean below the gum line. For the lower, pass the floss and threader upwards from inside and below the arch wire. Again, be sure to clean below the gum line.
Cavities are permanently dented areas in the hard surface of our teeth that build up into tiny holes. They are mainly frequent in children, teenagers, and older adults. But anyone who has teeth can get cavities, including infants. So, what causes these holes or degradation? Well, it is caused by a particular bacterium that resides in our mouth without paying any rent. Let's call these unwanted guests germies. These germies begin to expand their family. Our eating habits play a vital role in this process. The leading causes of tooth decay are sugary, sticky foods and drinks. Tooth decay occurs when foods containing sugar gets trapped between your teeth, and if not wholly cleaned, these germies consume the trapped food, specifically sugar, and use it as the energy source, generating an acidic byproduct such as lactic acid. This acid digs a corridor for germies into the tooth's secondary layer called dentin. Once the passage expands beyond dentin and nerves become exposed, the bacteria's invasion begins causing unbearable pain. But don't worry, my friends, there are ways to save our teeth and fight these notorious germies. Let's have a look at them. Number 1. Brush regularly with fluoridated toothpaste and add fluoride in your water. Number 2. Floss daily. This habit helps promote healthy teeth as well as healthy gums. Number 3, and the most difficult one to follow. Minimize sugary foods and drinks that feed the bacteria.
Let's look at the specific functions of your teeth. Your 4 front teeth are called incisors and are used for biting into food. The teeth we commonly refer to as eye teeth are called canines, and they are for tearing. Your back teeth are called molars and premolars and perform all the chewing and grinding. Incisors that are unable to properly bite food can make eating bothersome and frustrating. Many people become self-conscious of their poor biting or chewing abilities. If the molars don't fit together properly, The job of grinding food will be transferred to the front teeth. This extra workload can cause excessive wear on the front teeth and makes chewing less efficient. Following are some examples of poor bites, with explanations regarding how they affect teeth function and facial appearance. Overjet. The upper front teeth extend beyond lower front teeth. Because they stick out, they can easily get hit, chipped, or even knocked out. Biting into food can also be frustrating because the top and bottom teeth don't touch. Some patients will even experience speech difficulties, and the lips may not fully close over the teeth. This can make the mouth look top-heavy, especially from the side view. Overbite. The upper front teeth bite too far down over the lower front teeth. This can result in the lower front teeth biting into sensitive tissues on the roof of the mouth. Chewing can be difficult because the jaw cannot function normally. Also, the lips don't fit properly, which can make the mouth appear misshapen.
Oral habits, like not swallowing the right way and breathing through your mouth, are the main causes of the crooked teeth and jaws. The forces of the tongue, cheeks, and lips combined with these bad oral habits can have a big effect on how your teeth are positioned, as well as how your jaws grow. A normal top jaw grows properly because the tongue rests in the correct position, which is in the roof of your mouth, known as the correct tongue resting position. If your tongue does not rest in the roof of your mouth, the top jaw will become too narrow, so teeth won't have enough room to grow straight.
Over time, thumb sucking can have a dramatic impact on the alignment of teeth. A thumb habit appliance can help break this habit. The appliance makes it impossible to create suction, which is where the feeling of satisfaction comes from. Once the habit is broken, the teeth will start to return to their natural position.
Oh, may I see your teeth, please? Oh my, your teeth are all misaligned.
Really? Now what?
Now, we need to get them fixed by addressing a perfectly aligned question. How do braces actually work? Misaligned teeth or funky teeth aren't just about looks. They can mess with how you talk and eat and can make you self-conscious about your smile. Plus, they can be tricky to clean, making you more prone to tooth decay, gum disease, and even tooth loss. So, it's no wonder that dentists recommend fixing teeth with braces, the shiny dental tools that help straighten out the clutter in your mouth. But how do these braces actually work their magic? Believe it or not, braces fix your teeth by basically breaking your jaw bones. Sounds wild, right? Let's break it down. First, your orthodontist starts by giving your teeth a thorough cleaning and drying. Next, they apply a special glue to the center of each tooth. Then brackets. Those tiny metal or ceramic pieces are carefully positioned and pressed onto the glue on each tooth. Once all the brackets are in place, the orthodontist threads a thin metal wire called an arch wire through the brackets and secures its ends to the back molars. Finally, small colorful elastic bands are placed over the brackets to hold the arch wire in place. These elastics can even be your favorite colors, adding a splash of personality to your braces. When the arch wire is tightened, it applies a continuous, gentle pressure which is transmitted through the brackets to your teeth and the periodontal ligament or PDL, a bit of tissue around your teeth under your gums. The PDL contains cells called mechanoreceptors that detect this constant pressure and send a signal to your body that something needs to be fixed. So the mechanoreceptors alert your immune system, which sends in special cells called osteoclasts to the rescue. These osteoclasts release acid and proteins to dissolve parts of your jawbone, making room for your teeth to move. It's like your body is doing a mini demolition job to make space. Once the pressure is relieved and gaps are created, the mechanoreceptors call in another set of cells called osteoblasts. These guys are the builders, depositing minerals in the gaps to build the jawbone in a new shape, allowing your teeth to settle into their new positions comfortably. But the journey doesn't end there. Braces require regular adjustments by your orthodontist, typically every 4 to 6 weeks. During these visits, the orthodontist will tighten the arch wire, replace the elastics, and sometimes adjust the brackets. Each adjustment applies new pressure to the teeth, encouraging them to keep moving. After months or even a few years of adjustments, your teeth will have moved into their perfect positions. Then it's time for the big day. The braces come off. This process is quick and involves popping of the brackets and cleaning the remaining glue from the teeth. But wait, there's one last step. You'll likely need to wear a retainer to keep your teeth in their new positions and prevent them from shifting back. So while the braces might sound like a mouthful of trouble, they are actually an amazing tool for transforming your smile and keeping your teeth healthy. Plus, you get to rock those colorful bands and show off your brace face pride.